Hello, good evening. It's Dr. Trudy once again. Welcome to Open Clinic with Dr. Trudy on YouTube. Today, we're talking about the most important organ in the body. We're talking about heart. We're talking about heart attack. Now, it's important you pay attention to this topic because so many people might not know exactly what heart attack is. So many people might not know the presentation, the symptoms, the signs, the likely thing that might have led to this. Thankfully, it's something we can collectively do something about. So, thankfully, there are things we can do to prevent heart attack. Now, there are also things we can do if we notice that someone is currently experiencing heart attack. My name is Dr. Tridi Ufondu. I'm the convener of tonight's clinic. So please quickly settle in. And as soon as we have a good number, I'm going to start. So we're talking about having a good understanding of what heart attack is all about, looking at the symptoms, looking at the likely causes. Then we're going to look at preventive measures. So please, when you come in, let me know who you are, where you're located. I'm going to give my presentation. Then once I'm done, I'm going to open the clinic. You will ask all your questions. If you notice, it's not our regular fertility topics here and there, but we have to be alive to have a chance to become parents. Now, heart attack might present differently in women compared to men. There are some people that might be having what we call silent heart attack. There are some people that might be having heart attack and their symptoms can be misplaced. So you might think you have ulcer, you might think you're having other things, but you won't know you're having heart attack. So that's why it's important you pay attention. So I'm going to kind of hang around a little bit to see who else will join. But remember, every Tuesdays, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. So if you're in Nigeria and you're just about sleeping, it's important you spare me a few minutes so we can understand this better. I'm actually going to start. So when we talk about heart attack happens when there is blockage of blood in the heart. That's as simple as the definition can be. Heart attack happens when there is blockage of blood returning or leaving the heart. Now, majority of the things that will lead to heart attack is actually coming from blood clot. Remember, anytime our blood is exposed to oxygen, it clots. So clotting means it moves from liquid to somewhat solid form. So when we have an episode, when we have an event that leads to blockage of blood in the heart ordinarily is supposed to be pumping blood and receiving blood in seconds. So when you have this massive, impactful blockage of the normal function in the heart, and the heart is no longer receiving blood, this condition is called heart attack. It's also called myocardial infarction in medical practice. Don't worry about it. So simply understand that heart attack happens when you are not getting enough blood in your heart. Now, the heart is meant to pump a lot of blood. And when you're pumping blood, what does the heart do? Distribute oxygen to the whole body. When any part of your body doesn't get oxygen, you're practically a dead person. For you to function properly, you need oxygen. And blood carries oxygen. So any part of your body deprived of oxygen will die. So heart attack is an emergency. Now, without blood, we can't function. Without blood in the tissues, without oxygen in the tissues, we are all going to die. So when heart attack happens, it's an acute emergency. It's something we need to do something immediately. We cannot afford to waste any second because any time we waste when heart attack strikes is actually going to affect the function of the heart. And we cannot afford to waste any time. The more time that passes without treatment to restore the blood flow to the heart, the greater the damage to the heart. And once the heart is damaged, most times, unfortunately, it's very difficult to repair. So imagine something happening to the powerhouse in the body. There is no part of your body that doesn't need oxygen. Any part of your body that gets deprived of oxygen is going to be dead. When you don't have oxygen in your brain, you have stroke. which we call cerebrovascular accident. So oxygen is very important. Now, I'm going to share a couple of statistics, which will actually make you to wake up. In America, I live in America, every 40 seconds, someone is having heart attack. Every 40 seconds. Now, every year, we have about 800,000 plus people developing new heart attack. So think about that for a moment. Now, out of this, it's actually 600,000 that have fresh heart attack. Unfortunately, some people do not have access to care. Because heart attack is an emergency, if you can't get to the hospital and you find a good doctor that will diagnose or intervene, you are likely not going to make it. Now, let's talk about the symptoms. What are the commoner symptoms that will tell us that this person might be having an attack? What are those symptoms that will send you to the ER immediately? So ER in America, it's emergency room. It might be accident and emergency in Nigeria. Nigeria is A&E, accident and emergency. But in America, it's called ER. You have to call 911. You have to find a way to begin to go to the hospital. Number one presentation, number one sign you might likely be having heart attack is what? Chest pain. Now, this chest pain can come in form of discomfort. It can come in form of uncontrollable pressure, squeezing, fullness. So it can present, in a non-characteristic way. So anytime you don't understand anything happening in your chest, it doesn't matter if it's 12 a.m., it doesn't matter if it's 2 a.m., please tell your partner or please call 911. It's important you do this. Now, this fullness, this discomfort, this pain, most times will center on the center of your chest. Remember that the heart is predominantly located on the left side of the chest. So the apex of your heart, which is where you have the biggest sensation in the heart, is actually below the left breast. Now, some people can also present with shortness of breath, both with chest discomfort or without. So shortness of breath means you are feeling like you're choking. You are not breathing in air. Air is not coming out. You feel like you're gasping for air. That's called SOB, shortness of breath. Now, some people can experience pain in different places, which if you're not careful, you wouldn't even know you're having a heart attack. You can experience pain in the jaw. You can experience pain in your neck. You can experience pain in your arm. You can experience pain in the shoulder, and you can experience pain in the stomach. Sudden shoulder, jaw, neck, arm, stomach pain with shortness of breath, with tightening in your chest. It's possible you might be having heart attack. Now, some people will feel like they want to vomit or they will actually vomit. Some people will feel very lightheaded, unusually very tired. You know yourself. If you are someone that walks a lot, definitely when you come back in the day, you're going to feel tired. But when you notice lightheadedness, it's so difficult for you to lift your hand. My sister, my brother, possibility is you might be having heart attack. If you suddenly notice you are sweating excessively in a cold place, it's possible you might have heart attack. Now, listen to me carefully. I'm not saying that every of these symptoms I mentioned, once you have them, you have an attack. Please relax, because relaxation is also important. Anything that has to do with your heart, you have to relax. Your duty is to go to the emergency room. Let the emergency room people make the diagnosis. I know we are fond of calling ourselves, I'm having depression, I'm having this. Please let the doctors be the people that will make the diagnosis. Now, both men and women, the most common symptoms, the most common presentation of heart attack is what? Chest pain. This type of chest pain is what we call angina pain. Very important. Now, the problem with women tend to confuse their symptoms. So some women might just neglect their symptoms. They might think it's just nothing. They might just say, maybe I'm having ulcer. They might just say, maybe I'm hungry, or maybe it's part of my menstrual pain. Then you miss the symptom. Then you don't seek help. But here's what you need to do. If you have any of the symptoms I mentioned, please pick your phone, call 911, or call emergency in your area, or tell someone to begin to send you to the emergency room. Once you get to the emergency room, they are supposed to attend to you. Emergency means you don't supposed to buy card. They are not supposed to be asking you if you have money or not. They should save your life first. If you have these facilities in your country, you might be around, you might be alive by doing the right things. Now, what is the cause of heart attack? The commonest cause of heart attack is what we call coronary artery disease. This is the major cause of heart attack. Coronary artery is a major vessel, a major blood vessel that plays a big role in the overall functioning of the heart. So if anything blocks or damages the coronary artery, then the heart is not going to pump blood or receive blood appropriately. So this is the number one cause of heart attack or myocardial infarction. Now, there are a couple of things that can predispose to this. Now, for example, if you have high cholesterol, the deadly cholesterol, which is the low density lipoprotein, they can gradually be covering the coronary artery. So it will be covering it with what we call plaque. So over time, it will no longer be open. Blood cannot be passing freely. And before you know, if it covers it completely, you're actually a dead person. So any second that is missed in someone that has heart attack might be deadly. Now, some people can also have what we call severe spasms. So severe spasms means when we go to this coronary artery, they kind of have a sudden contraction, which can suddenly stop blood flow in any of the muscles. Let me tell you how the body functions. Remember those periods you can sit in one part of your body for a long time. Then when you release that part of the body, your hand feels numb. Have you noticed it before? Imagine when your heart is not receiving any blood. Your heart is where the whole blood gets distributed to the whole body. So these are the two major causes of heart attack or myocardial infarction. Now let's talk about prevention, because I don't want to put any fear to anybody. So I always want to talk about prevention. Thankfully, in as much as heart attack can be scary, but guess what? If we work on what we eat, if we work on our lifestyle, we can have some strategies to prevent heart attack and heart diseases. So we can prevent this by adopting healthy lifestyle. Your heart, healthy lifestyle. Your heart can be recovered. Your heart can be prevented from developing this. So heart disease is the leading cause of death, and especially among women. Number one killer of women in America is heart disease. So think about that. The reason why we normally emphasize women is because predominantly our population is women. But when we can modify ourselves in all the things I'm going to tell you now, we can have a chance to avoid development of heart attack, or if it happens, we can know what to do. So while we can change some risk factors, there are some risk factors that might predispose you to developing heart attack, like your age, like your gender, like your family history. We can't change your family history. We can't change your age. We can't change your gender. But there are certain things we can change. And I'm going to take time to talk about the things you have to avoid. Number one, you don't have any business with smoking. Now, there are two types of smoking. You can be a primary smoker. That means you are the person that will light the cigarette and you start smoking it. You are a primary smoker. Or you can be a secondary smoker. So one of the best things you can do for your heart is to stop smoking or using smokeless tobacco. Any form of tobacco, run away. You don't need them. One of the biggest factors that might predispose you to having heart attack is smoking. Now, even if you are not a smoker, but your husband smokes, your father smokes, your brother, your friends, your colleagues, you are smoking, but you are now smoking secondarily. So secondhand smoke is also as deadly as first-hand smoke. So anytime you have people around you that smoke, either you excuse them or you have them excused. Please take this very serious. I know we love to push everything out. Oh, it's them. There are chemicals in tobacco that damage your heart and your blood vessels. So cigarette smoking will reduce the oxygen in your blood. And when it reduces the oxygen in your blood pressure will go up. Your heart rate will go up. And because the heart will be putting in a lot of work to work, your heart will begin to receive fewer oxygen. And before you know it, your heart will die. So the good news, the risk of heart disease starts dropping once you start quitting. So if you can stop smoking today, you will gradually start recovering your health, especially your heart health. Now, after a year without cigarette, the risk of developing heart attack drops by about half that of a smoker. So think about that. So anytime you are not smoking, you are actually protecting yourself. So avoid smoke in any shape or form. Anywhere you see smoke, run away. Number two, you have to move around. Get moving. Sitting is the new smoking. There is absolutely no reason why you will wake up in the morning from your bed to the couch, to the car, to the elevator. You haven't moved. Since today, you've been sitting in one place, you've been gulping all the gossip on the internet. That's not a good way to avoid heart attack. You have to move. You have to aim for at least 30 minutes to 60 minutes of activity every day. Regular daily physical activity can lower your risk of having heart attack. Physical activity will help to control your body weight. When your body weight is controlled, it reduces the chance of developing heart attack, which will put a lot of strain on your heart. So when you add a lot of body weight, you can also have a lot of pressure on the heart, because anytime you add a lot of body weight, you are increasing the work rate in the heart. And when your heart begins to work more than your heart should, you can have what we call cardiomyopathy. Your heart can enlarge, and when your heart enlarges, that's a problem. If there is any organ in the body we don't want it to be enlarged, it's your heart. So some people can have heart enlargement, and before you know it, you're going to go. So move every day, because when you move, you're going to control your blood pressure, you're going to control diabetes, you're going to control your body weight, and by default, you will have an opportunity to improve your heart function. So if you have not been active for a while, you might need to start slowly. Don't go too hard. Just start slowly. Then you walk up to your goal. So you can adopt 150 minutes a week of moderate exercise, like going for walk or brisk space or running. Or you can make it to 75 minutes of vigorous aerobic activity, like running, just weekly. So go easy. Now, over the week, you can throw in 2 or more strength training section. If you can do this, you are in the right direction. Even a short form of activity can benefit your heart. So even if you're just climbing your staircase up and down, even if you parked your car a very far place, then you trek to your car instead of entering the elevator, even if you're using the staircase, like I walk on the 4th floor, every time I go into work, I don't use the elevator. I use the staircase. I park my car very far away. Why am I doing this? I'm meticulously and consciously putting in my steps every day. So 5 minutes of moving around can help. Activities like housekeeping, gardening, taking the stair, walking the dog, they all count. But for any reason, please move. Now you have to eat healthy, heart-friendly diet. Your healthy diet can help to protect your heart, improve your blood pressure, improve your cholesterol, and reduce the risk of developing type 2 diabetes. Now, your heart's healthy plan must include your fruits and vegetables, beans or other legumes, lean meat, lean fish, low fat and fat-free dairy products, whole grain, and healthy fatty acids like olive oil. Anytime you are eating and you're conscious and you're consuming your vegetables, you're consuming your legumes, you're consuming your lean meat, you're consuming your low fat or fat-free products, you are consciously adopting diets that will protect your heart. Now, there are principally 2 examples of this specific diet. We call it dietary approach to stopping hypertension, DASH eating diet, or the Mediterranean diet. Now, overall, please limit your sugar, limit your salt, limit processed carbohydrate, definitely work on your alcohol, possibly stop it completely. Now, limit your saturated fats, which is found in red meat, food dairy products, trans fat. So if you form the habit of eating fast food, chips, baked goods, ice cream, cake, and all that, limit them. You don't need them now. You need to be careful. Now, you have to maintain a healthy body weight. Now, how do you know if your body weight is healthy? There is actually a method of checking that, which we call body mass index. So when you plug your body weight on top and you plug your height below, squared, you're going to get your BMI, body mass index. I want you to target 18.5 to 24.9. That's the normal range. I don't want you to be below. I don't want you to be above. So if you can target this, it will help to guide you if you have a healthy body weight. When you have excessive body weight, it will lead to predisposition to developing heart disease, high blood pressure, high cholesterol, type 2 diabetes, which overall will affect your heart, and by default, it will affect you likelihood of having heart attack. So someone that has diabetes, someone that has obesity, someone that has that hypertension can easily develop heart attack compared to someone that doesn't have it. So if you currently have it, now begin to work towards reducing these whole factors. Now, this one is very important. So many people are getting this wrong. You have to get quality sleep. You see, sleep is very therapeutic. Sleep is very, very good for your heart. So adopt good quality sleep. We notice that people who do not get enough sleep will have a higher risk of having obesity, high blood pressure, heart attack, diabetes, and depression. Think about all these nyama, high blood pressure, heart attack, diabetes, and depression. Unfortunately, some people can have all this in one person. It's not good. So you need at least 7 hours sleep every night. Make sleeping your top priority. Have a sleep schedule. Once you are done for the day, switch off all your electronic gadgets and go to your room. Make sure your room is dark. Make sure your room is quiet. Then sleep. If you feel like you've been getting enough sleep, but you are still tired, it's possible you might be having obstructive sleep apnea. Ring your doctor. Let's make sure you don't have this. Anybody that has sleeping disorder, it might actually be a sign that your heart is failing. So you need to be very careful. Now, if you notice you're snoring, you're stopping breathing during your sleep, of course, it's your partner that will notice this. Please ring your doctor. Let's make sure you don't have obstructive sleep apnea, which might be a deadly sign. You might think you're living, but you're just a dead person. So be careful, okay? There are treatments we can give you. Now, you have to manage your stress. Stress is a very, very big risk factor in developing problems with your heart. So when you are stressing, you tend to overeat, you tend to overdrink, you tend to smoke. So find alternatives to manage your stress, like physical activity, like going for walk, like relaxation, like music, like meditation. Anything that improves your mood, anything that makes you to be stress-free, please adopt them. It will help your heart. Now, finally, you have to go for regular health screening. Regular health screening. If you don't go for your blood pressure measurement, how will you know that your blood pressure is up? If you don't go for your cholesterol check, how will you know that your cholesterol level is up? So we need to have regular checks. If you don't check, you will know. So your blood pressure needs to be checked. Now, this is very, very important. There are some people that have family history of hypertension. There are some people that have family history of heart disease. There are some people that have family history of diabetes. Please, starting from age 18, you are now an adult. It's expected that at least once every 2 years, we screen you for high blood pressure from age 18. Now, if you have a family history, that means your daddy died of heart attack, your daddy had hypertension, your daddy had diabetes, you have to start a little bit early. Now, if you're between 18 to 39 and you have other concomitant risk factor of developing heart attack, then you have to be screened every single year. Now, if you are above 40 regularly, so the older you are, the more likely you're going to develop problems. Definitely, we need to check your cholesterol level. Make sure you have the good one. So there's a good type of cholesterol we call high density lipoprotein. But we don't want you to have increased low density lipoprotein, which is the deadly bad type of cholesterol, which will go and cover the blood vessels and oxygen will no longer be available. So we need to keep an eye on your blood pressure, keep an eye on your cholesterol level, and definitely keep an eye on your sugar level. Now, when you do all this, possibility is you would have prevented yourself from factors that would have predisposed you to developing heart attack. So if you have any of the condition, high blood pressure, high cholesterol, diabetes, obesity, please work with your provider, change your lifestyle. If need be, we need to give you drugs. Please, let's make sure we give you the drugs. Now, if you notice any of the symptoms I mentioned, please ring your doctor immediately and go to the emergency room immediately. Okay, so thank you guys for attending. Now the clinic is going to open, so please feel free to ask your questions in real time. So the clinic is now open. I'm ready to take care of your questions. Make sure you share this video with anyone out there. It's applicable to everybody. So please start asking your questions. And if today is the first day attending the clinic, remember to subscribe, remember to like, remember to comment, and remember to share. There are so many good topics. There are so many amazing videos in our channel. Any day you show up on Tuesdays and Saturdays, you will definitely learn something new. But right now, the clinic is open. Please start asking your questions. I can see Amara, I can see Tosin, I can see COO. Okay. Doc, is there a difference between heart attack, heart failure, and cardiac arrest? I love that question. So you see, in medical practice, sometimes things are used interchangeably. Now, heart attack and heart failure are not the same thing. Now, when your heart fails because probably it's got a lot of heavy load on it. So the four chambers might not likely function exactly the way they are. So there are differences between heart attack, heart failure, and cardiac arrest. So they are not the same thing. What we're talking about today is the inability of blood that should ordinarily be subserved to the heart being shortchanged, and you're not getting them, and practically the cells in your heart will die off. This is called myocardial infarction. It's not the same thing with heart failure. It's not the same thing with cardiac arrest. Okay? They are different terminologies, but they are all intertwined because everything is happening in your heart at the same time. Is it safe to exercise after recovering from heart attack? Now, see what you need to do. You are going to be under the care of a cardiologist. Now, when you go to a cardiologist and you have any suspicion, if they suspect you're developing heart diseases, if they suspect you're having heart attack, if they suspect you're having myocardial infarction, if they suspect you're having cardiac arrest, they will do what they call stress test. So exercise under monitoring. So they will plug your body with a lot of leads, with a lot of electrical circuits, and monitor how your heart and your vessels are functioning. So when you have a medical challenge, when you have an emergency especially, that's not the time to be a superwoman or a superman. So definitely you are gonna gradually be given instructions. Definitely that's not the time for you to go and start exercising by yourself, because what will happen? If your heart is not getting enough blood and you're still putting your heart into a lot of stress, you're practically gonna kill yourself. So you're not supposed to engage in any exercise until your cardiologist, who will monitor you and tell you when to begin, little routine work and all that. So follow the instructions of the cardiologist. First of all, they're going to take you through what they call stress test. Stress test its ability to put your body under stress, especially the heart. Then they monitor how your body, how your heart, how the vessels are handling the stress. So don't engage in any form of exercise when you've had any cardiac episode. Don't. That's not your place to do that. Let the cardiologist be the person that will follow you up and tell you what to do. And if need be, place you on some treatment. Definitely, you might likely be on admission, and some people might require surgery. Okay, I love that question, Kenneth. All right. What about pregnancy and past history of heart attack? Any contraindications? Now, pregnancy can complicate heart attack. Heart attack can complicate pregnancy. So anytime a woman is pregnant, and prior to that pregnancy, we noted a family history of hypertension, diabetes, obesity, heart problems, we monitor her closely. So any cardiovascular issue prior to pregnancy, or the one that is developed during pregnancy, we have to keep it closely. Heart attack, heart problems, heart diseases, hypertension can complicate pregnancy, and pregnancy can make it worse. So if you have pre-existing heart problem, pre-existing hypertension, pre-existing diabetes, pre-existing cholesterol problems, our duty is to make sure it's controlled. When you become pregnant, we keep monitoring you, and there are some safe medication we can give you in pregnancy to make sure we have an equilibrium. That's what we need to do. So anytime you develop any chronic medical problem, so chronic medical problems are medical problems you're going to have till you die. So things like hypertension, things like diabetes, things like cholesterol, over time you might go off the medications, but you still have them. It's something you manage until you go. You cannot cure them completely. I hope you understand this. Now, you might be diabetic, you might change your lifestyle, and over time your doctor will remove you from all the anti-diabetic drugs. That's okay. But it still doesn't mean you don't have diabetes. You still have to live healthy. Unfortunately, they are called chronic medical condition. Just like if you have asthma, you're going to have it until you go, but you have to keep managing yourself so you don't predispose yourself to allergens. Okay? Can the misuse and abuse of libido enhancing drug lead to heart attack? 100%. Why? Let me tell you why. Now, some people might have very poor ailing heart and blood vessels, right? Now, some of the drugs they normally give for all these, sexual enhancing, purposes, like your Viagra, like your, the local ones that people consume, there are some blood medications that will go and open your vessels up. They are called vasodilators. Now, some of these enhancing drugs, they are also vasodilators. So what will happen? Remember, when you're making love, you are using two parts of the nervous system we call the sympathetic and the parasympathetic. So what will happen if your vessels open? They will dilate. What will happen when your blood vessels open? There will be massive return of blood. And if this massive return of blood goes to your heart and your heart cannot contain it, you have overload of your heart. And when your heart fails to manage them, all the important organs in the body can fail. So the answer is yes. Abuse of all those sexually enhancing drugs without due consultation or taking it by yourself, or you want to impress your woman, you can actually die doing that. Some people might even have undiagnosed medical problems and they will be taking all this because their friends took it. What worked for your friend might not work for you. So you need to be careful. I'm talking to the men. So you can have a serious complication. Be careful, okay? If you have to use enhancers, make sure your doctor is the person prescribing it and make sure you follow it religiously. Don't take the matters into your hands. You can enjoy your sexual relationship within one day and the other day you're gonna die and go. Yes, be careful, because sex itself is a form of exercise. You need a lot of energy. Anything you do repeatedly is a form of exercise. So if you don't have good health, if you don't have stamina, that's why so many men cannot perform, because they don't have stamina, because they're not fit. So you have to be fit to participate in lovemaking. That's why some of your men might be giving you excuse because they don't exercise, they drink a lot of alcohol, they are snoring, they are not sleeping properly, they are stressed. So how can they perform? Okay? Is lovemaking safer after recovering from heart attack? Remember, lovemaking can have different intensities, right? So there are mild, there are moderate, there are extreme, then there are crazy lovemaking. Of course, there are some people that are engaged in acrobatic lovemaking, and there are some people that can make love for a long time. Definitely, when you recover from heart attack, you're gonna go easy. Matter of fact, some providers will even tell you not to go to the lovemaking aspect because lovemaking requires a lot of energy, a lot of exchanges of blood. So we don't want anything that will cause you stress. We don't want anything that will put stress to the heart. We don't want anything that will put stress to the brain. We want you to recover quick, slowly. So if you're someone that recovered from heart attack, first of all, you're gonna actually be in the hospital. So your partner will not even see you to start to demand sex or you begin to have problems. And the possibility that your libido will be low is very, very high. So sex, because the process of sex, the process of lovemaking, the process of ejaculation, all those build up, it requires a lot of energy. It takes a lot. That's why if you're in a cold place and you reach orgasm, you begin to sweat. Anything that requires a lot of people, you guys can see I'm sweating, right? Ordinarily, I'm not supposed to be sweating, but I'm talking and I'm using a lot of energy and I'm sweating. So anytime you're using energy, it's expected you consume a lot of energy and you burn a lot of calories. Okay. So if you are someone recovering from heart attack, definitely it's not the time to be going into acrobatics and all those extreme forms of lovemaking. Go easy. You have to be around now to have lovemaking next time. Okay. All right, guys. So do we still have any other question? I love those questions. Beautiful questions. So what we're going to do after this clinic, we're going to navigate to our Facebook page and we're going to have 30 minutes opportunity to still talk about this topic. The reason is because we have fewer population in our YouTube, but we have more people in Facebook. So any topic that will benefit the two communities, I find another 30 minutes to make sure I share the knowledge with the people in our page. So thank you so much for coming. Please click on share. Share this particular video with someone it will help. It might likely save someone's life. And please adopt those 8 steps that will help you to prevent heart attack. Now, in the event you experience any of the symptoms I mentioned, it's better you live to tell the story than to wait till the following day. So it's better you make frantic effort to go to the hospital, make sure you call 911 and use the facilities you have around you, and make sure you have a good form of transportation and someone you can easily reach out if there is an emergency. Okay, so thank you so much for coming. And I'll see you guys again on Saturday. So the next clinic in YouTube is going to be on Saturday, 12 p.m. Eastern Time, 5 p.m. Nigerian Time. Until I see you, thank you so much. And I'll see you in our Facebook. Bye-bye for now. God bless.